Hello doctors, I'm your med buddy Arun and I welcome you to my 7th lecture of series Diseases Caused by Gram-Positive Bacteria. And in this lecture I'm gonna tell you about Clostridia species that produces botulinum toxin. In this lecture I will take you through the epidemiology, etiology, pathogenesis, clinical features, diagnosis and treatment of botulism. So let's get started. Clostridium is the most toxic group of bacteria. There are 25 members in Clostridium group that produces lethal toxins. And one of the toxin which is the most lethal known yet on this earth is the botulinum toxin, which causes botulism. Lethal dose of this toxin is only 1 to 2 microgram. This toxin is also an endopeptide which can be eliminated by boiling for 20 minutes at up to 100 degrees Celsius. Botulism or botulinum is produced by 4 species, that is Clostridium botulinum, that produces the A subtype of botulinum toxin. The A subtype is the most aggressive toxin and is the least found one. It enters through the wound. Clostridium butyricum, it produces E subtype of botulinum, which is generally found in aquatic animals and preservative foods. Clostridium bateri, it produces F subtype of this toxin and it is variably present in different things. Clostridium argentinis, it produces B subtype of this toxin and it is the least aggressive. Epidemiology. Clostridia is worldwide present and botulism is a disease that is seen worldwide, but because of underreporting and no reporting committee on this and lack of technology that can detect botulinum toxin, it makes it a rare phenomena. Etiology. The source of entry could be the food, could be the wound, could be the honey in case of infants. It can be etiogenic, that is when there is excessive use of Botox in cosmetics. In adults, intestinal colony can lead to botulism. Inhalation can also be the root of this and it is also one of the potent bioweapon. Pathogenesis. The botulinum toxin or Clostridia species, one of these species can enter the body either through wound or inhalation or intestinal route, and after entering, once it finds the anaerobic environment inside the body, the spores of this bacteria will start germinating and the bacteria will start proliferating. Soon after proliferation, it will start producing the toxin, that is botulinum toxin, and this toxin will be absorbed right either from the intestine, if it is inhalational route from the lungs, or right from the wound. It has the similar structure as the tetanus toxin. It also carries fragment A and fragment B of the same weight, that is 50 kilodalton and 100 kilodalton for B. Then it will get internalized through the same way that tetanus toxin entered. After internalization, it will start entering the presynaptic membrane of cranial nerves and motor nerves. And by following the same mechanism of using both these fragments of of the toxin A and B, it will, in this case, it is gonna inhibit the snare proteins. Snare proteins are important for increasing the level of acetylcholine. Once snare protein is absent, acetylcholine is not gonna release, and it is gonna lead to flaccid paralysis and systemic failure. Now let's talk about how it happens. It can enter through a wound. The spores will enter the wound and they will germinate and start producing the toxin. Toxin will inhibit through all this pathway. The snares will be inhibited and acetylcholine will become lack. On the consumption of contaminated food, that is mainly the aquatic food or the canned food, if the food is present at a pH that is more than 4.5, low sodium and sugar, and at a temperature more than 3 degrees Celsius, there are high chances that the food is gonna favor the growth of this bacteria, and botulinum toxin will be available already in that food that will directly be absorbed from the intestines and will lead to reduced acetylcholine. In infants, basically infants have an underdeveloped GI flora, which makes them more susceptible to this infection. There are cultures in many countries where they give honey to the newborn. This honey is not gonna make that newborn a superhuman, but it may lead to drastic things in that infant. And once honey, that is the contaminated honey carrying those spores, that is easily gonna germinate and proliferate inside the intestine of that baby, and toxin is gonna be produced and absorbed and leading to botulism. In adults, heavy use of antibiotics reduces the GI flora and makes them more susceptible for the growth of this bacteria. And for incubation, if the route is food or respiration, it is gonna be 8 to 36 hours. If it is a wound, then it can be from 4 to 70 days. Clinical features. There are specific clinical features seen in the botulism, that is, the weakness descends from head and neck area to the body area. And in the person in early phase, what we are gonna see? We are gonna see diplopia, ptosis, ophthalmoplegia, facial paralysis, reduced gag reflex, reduced pupillary reflex, dry mouth, dysphagia, and due to dysphagia, this dry mouth is again gonna turn into pooling of the secretions in the mouth, which is gonna require the suctioning of that pooled mouth, and later it is gonna lead to paralytic ileus. Now these features may look like the person is either drunk or is mentally ill, but there is something special in this, that is, the person might be falling in all these things. Later the person is gonna fall into bilateral flaccid paralysis and cranial nerve palsies, quadriplegia, and respiratory failure as well. But during all this time, the mind of person is completely alert and oriented. He's gonna know everything, he's gonna listen, he's gonna see everything, and he can analyze everything, still if he is falling into these clinical features. Now the diagnosis. For diagnosis, first of all, clinical features are the base of diagnosis. What we are gonna do to diagnose this is that we need to do the differential diagnosis and rule out other things such as myasthenia gravis, Barrett's syndrome, Uten-Combert syndrome, tick-borne paralysis, stroke syndrome, and meningitis of group B streptococci. We have to rule out these things because though technologies are available to detect the botulinum toxin directly, but they are not available everywhere. So we have to rule out these diagnoses to reach up to the diagnosis of botulism. And for ruling out what we can do, we can use brain imaging. In botulism, brain imaging is gonna be completely normal, while in other things such as Uterine-Cumbered syndrome, Barrett's syndrome, it is gonna be pathological. While in things such as group B streptococci meningitis, there is gonna be increase in CSF protein and neutrophil, and it is gonna be normal in botulism. The hydrophorium test will be positive in myasthenia gravis, but it is gonna be negative again in botulism. So like this, we have to rule out other causes. And if technology is present of detecting this botulinum toxin, then it is the best thing. What we are gonna do, we are gonna take the sample of sputum, stool, gas, GI, and the aspirate of the lungs, and we are directly gonna send them to the lab, and we are gonna detect the botulism toxin. Now the treatment. Because the person is soon gonna fall in all these clinical features, what we need is we have to provide the mechanical ventilation as soon as possible. We have botulinum antitoxins, and we have to administer them empirically. That means based on the prognosis of that person. We have to avoid aminoglycosides and any drug that blocks the neuromuscular junction, that is gonna make the situation more severe. If there is any wound, it should be cleaned and drained out. And antibiotics such as metronidazole can be given, but there is no surety that it is gonna work. Prevention is the best cure. Because there is no vaccine yet for this disease, so what we have to do for prevention? Avoid the canned food, avoid giving honey to the newborn, and if there is any wound, wash it thoroughly and keep a check on your health. This thing is gonna take weeks for recovering until all the toxin is gonna neutralize and degrade. Then only the person is gonna come back to normal life. We have to maintain vitals of the person, that is we have to maintain NPO, that is we cannot give anything from oral because of paralytic ileus, and person is obviously not conscious. Person is alert, but he is in paralytic form. We have to provide him IV bolus. We have to maintain body fluids, medication for controlling all the vitals, and all the treatment is gonna be based on the clinical features of that person and the prognosis. Thanks for watching.